Before we begin our discussion on emerging technologies in public health, let me ask you something. How many of you use your phone to check your daily steps, watch health videos on TikTok, or set reminders to drink water or wake up? Whether you realize it or not, you're already part of the digital health movement. In the past, public health relied heavily on paper records, manual reporting, and physical consultations. But today, emerging technologies are transforming how we understand and deliver healthcare, making it faster, more accurate, and more inclusive. As community health nurses, we are not just providers of care. We are becoming digital health advocates, professionals who use innovation to promote health and bridge gaps in access. So, today, let us explore how these technologies are changing our profession and the communities we serve. Emerging technologies are reshaping the way we deliver care. We now have tools that collect data faster, communicate better. They help us reach more people, even in the remotest of barangays. These tools do not replace what we do as nurses. They help us, they extend our roles. They make our services more efficient and our decisions more evidence based. Some examples are electronic health records for digital record keeping, telehealth for online consultations, artificial intelligence or AI for predicting diseases, geographic information systems or GIS for mapping outbreaks, and mobile health or mHealth for community health education. So, how do these technologies relate to what we do in public health? They help us, public health nurses, provide evidence based, population focused care. Instead of relying on assumptions, we now have real time data to guide interventions. For example, if dengue cases are rising in a certain barangay, we can act quickly. Technology also enhances disease monitoring and health promotion. With digital tools, we can track health indicators, send educational reminders, and communicate instantly with families and barangay health workers. And because information can move seamlessly from one facility to another, it strengthens continuity of care, ensuring that patients receive consistent support whether they are at home, in a clinic, or at the hospital. One of the most powerful benefits of digital health is how it promotes equity. Through technology, rural communities can now connect to our RHUs, local hospitals, through teleconsultation. Women, the elderly, and persons with disabilities who used to struggle accessing health care can now receive guidance without traveling far. This is so important and innovative, especially for our unserved and underserved areas. These innovations support the Sustainable Development Goal number 3, or the Good Health and Well-being, and SDG 10, Reduced Inequalities, both of which remind us that healthcare must reach everyone, not just those who can afford or access it easily. When we talk about innovation, we don't always mean expensive gadgets. Innovation can be as simple as finding new, creative, and context appropriate ways to solve health problems. For instance, using text messages, reminders to remind mothers about their child's vaccination schedule can be just as effective as high tech systems. The DOH telehealth program is another great example. It connects rural health centers to hospitals with specialists, proving that innovation can make care more accessible, even in low resource settings. On a global scale, the World Health Organization promotes a worldwide digital health strategy. It encourages countries to use technology not just for convenience, but for safer, more ethical, and more equitable health care. During the COVID 19 pandemic, we saw how telemedicine became a lifeline. It allowed patients to get medical advice from their homes, reducing exposure and ensuring continuity of care. Across the world, mobile health apps or mHealth are now used for tracking fitness, monitoring chronic illnesses, and improving vaccination compliance, showing how digital tools are empowering individuals everywhere. Here in the Philippines, we have made strong progress also. The DOH-DICT eHealth Strategic Framework for 2023 to 2028 is our national roadmap for digital transformation in healthcare. It envisions a future where all facilities, from barangay health stations to tertiary hospitals, are connected. Then there is the National Telehealth Service Program, a partnership between DOH and UP Manila, which allows rural health nurses and midwives to consult directly with doctors online. And during the pandemic, systems like COVID Kaya and Cheats helped nurses record and report cases quickly, leading to better surveillance and faster responses. As community health nurses, we stand at the center of this digital shift. We are the bridge between technology and people. We're not just users of these systems, we are interpreters, educators, and advocates. We take data and turn it into care that makes sense to our patients. We now handle teleconsultations, lead health education sessions online, and conduct surveillance using mobile tools. Many of you will experience this in your future CHN rotations, using digital forms and apps to collect real time health data in the field. So, why do we embrace technology in public health? Number one, because it allows faster, more accurate data sharing. Reports that once took weeks can now be transmitted instantly, improving planning and decision making. It leads to better outbreak, control, and coordination. When cases are tracked in real time, we can mobilize resources quickly, and it supports stronger health promotion. Social media platforms like Facebook and TikTok are now spaces where nurses can share health information, promote campaigns, and engage communities. Just imagine one short video can transform and inspire thousands. But of course, innovation always comes with responsibility. We must protect data privacy and confidentiality. Patient information should never be shared publicly or stored insecurely. We must also address low digital literacy. Many clients may not know how to use online tools safely. Part of our role is to teach them how to use technology responsibly. We must also always comply with the Data Privacy Act of 2012 or the Republic Act 10173 to ensure that technology serves people without compromising their rights. As we look forward, we nurses should realize that we are digital leaders. We are expected to be tech savvy, data driven, and equity focused. To do that, we need continuous training and collaboration, not just with other nurses, but with IT professionals, educators, and policymakers. And finally, let us remember technology is a tool, not a replacement for the heart of nursing. Computers may process information, but only nurses can deliver compassion. Technology enhances our care, but it is our humanity that gives meaning to it.